Health insurance versus workmen's compensation in the UAE. Understanding mandatory coverage across all sectors. The UAE has established comprehensive labor laws to safeguard the welfare of its workforce, mandating both health insurance and workmen's compensation. These two insurance types serve distinct purposes and are vital for ensuring employees' well-being and financial security. Let's dive into the details of their coverage, sector-specific requirements, and importance. Health insurance. Ensuring healthcare access for all employees. Health insurance is mandatory across all sectors in the UAE, as per laws in key emirates like Abu Dhabi and Dubai. Employers are legally required to provide at least basic health coverage for their employees, ensuring access to essential medical services. This applies to private companies, government entities, free zones, and domestic workers. Key features of health insurance. Comprehensive coverage includes medical consultations, surgeries, diagnostic tests, prescription medication, maternity care, and emergency services. Applicable sectors. Private sector. Employers must provide health coverage for all employees. Public sector. Government organizations offer extensive health benefits to staff. Free zone companies. Obliged to comply with health insurance regulations for employees. Domestic workers. Sponsors are required to insure housemaids, nannies, drivers, and other domestic staff. Dependents. While optional in some cases, Abu Dhabi mandates employers to cover dependents such as spouses and children. By providing mandatory health insurance, the UAE ensures that all employees, regardless of their sector or job role, have access to health care for both preventive and curative needs. Workmen's compensation. A lifeline for high-risk jobs. Workmen's compensation is a legal requirement under UAE labor laws, aimed at providing financial protection to employees who face work-related injuries, illnesses, or accidents. While it is mandatory for all employers, it is particularly critical in sectors with high occupational hazards. Sectors with high-risk jobs. 1. Construction and engineering. Workers exposed to heavy machinery, scaffolding, and hazardous environments. 2. Manufacturing and industrial. Employees dealing with chemicals, machinery, and assembly lines. 3. Oil and gas. Positions involving drilling, transportation, or refining petroleum products. 4. Transportation and logistics. Drivers and delivery personnel frequently on the road. 5. Healthcare. Medical professionals and staff exposed to infectious diseases and workplace hazards. 6. Hospitality and retail. Hotel staff, cleaners, and warehouse workers at risk of physical strain or accidents. 7. Agriculture. Farmers and laborers handling pesticides or working in challenging environments. Key benefits of workmen's compensation. Medical expense coverage. Covers costs associated with workplace injuries or illnesses. Disability benefits. Provides compensation for temporary or permanent disabilities. Lost wages. Ensures employees receive financial support during recovery. Death benefits. Offers compensation to the family in the event of a fatal workplace accident. Workmen's compensation guarantees that employees working in demanding and hazardous sectors have financial security and access to medical care. Key differences between health insurance and workmen's compensation. 1. Purpose. Health insurance covers general medical needs for illnesses, injuries, or preventive care. Workmen's compensation focuses solely on work-related injuries or illnesses. 2. Coverage. Health insurance applies to both work and non-work-related medical issues. Workmen's compensation is restricted to workplace incidents or occupational diseases. 3. Beneficiaries. Health insurance often includes dependents, optional in some emirates. Workmen's compensation benefits are exclusively for employees. 4. Applicable sectors. Health insurance is mandatory for all sectors. Workmen's compensation is particularly vital in high-risk sectors like construction, oil and gas, and manufacturing. Conclusion. Complementary protection for UAE employees. The UAE's labor policies underline the importance of employee welfare through mandatory health insurance and workmen's compensation. Together, these systems create a robust safety net for workers, ensuring healthcare access for all while addressing the specific risks faced in high-hazard industries. While health insurance promotes general well-being by covering routine and emergency medical needs, workmen's compensation safeguards employees' financial stability in the event of workplace accidents or illnesses. These initiatives demonstrate the UAE's commitment to fostering a secure and supportive working environment for its diverse workforce.